Yeah, thank you for inviting me to participate in this important discussion today. I'm Dr. Kristen Dall Winther, and for 22 years now have been a board-certified family physician in Wisconsin. I own and operate Birchwood Family Medicine, a direct primary care clinic in Northwest Wisconsin, and I have the privilege of walking alongside patients through some of the most important moments of their lives. After serving at Mayo Clinic for a decade, I opened Birchwood Family Medicine 5 years ago as a local solution to America's healthcare crisis, where we deliver outstanding primary care for 8 cents on the dollar. Although we do this explicitly by not billing insurance, every day I see how important it is to my patients' health and well-being when they need to access specialty and hospital-level care, for example, to get their chemotherapy or surgeries. I also see what happens when people can't afford that care because they don't have affordable insurance. That's why I'm speaking out today against the devastating cuts, Medicaid cuts included in H.R. 1. Representatives Tom Tiffany and Derek Van Orden voted for this legislation that slashes Medicaid and Forward Health and further threatens health care for hundreds of thousands of Wisconsinites. As physicians, we know exactly what that means. It means patients delaying care because they can't afford a doctor's visit. It means people skipping medications that keep them healthy. Sorry, I get really worked up about this because I know these people. It means families avoiding preventive care until a medical problem becomes a crisis. It means more people showing up in emergency departments with conditions that could have been treated much earlier. With politicians like Reps Tiffany and Van Orden, when they cut Medicaid, they're taking health care away from our children and our seniors, people with disabilities, veterans, working parents, and our rural communities that already struggle to access care. And the consequences don't stop with individual patients. Hospitals and clinics depend on Medicaid to keep their doors open and continue serving in their communities. In the last 5 years, we've seen Sacred Heart close, Prevea leave, OB services vanish throughout the region, and now Rice Lake doesn't even have an ICU any longer. When coverage is cut, providers face rising uncompensated care costs, and struggling rural clinics and hospitals face even greater financial pressure. It becomes impossible to care for patients when we can't pay the mortgage, not to mention the moral injury that is skyrocketing among healthcare providers as we witness these cuts leading to unsafe staffing shortages. So who exactly benefits from H.R. 1? Not patients, clearly, not doctors, just the ultra wealthy, the billionaire class. Representatives Tiffany and Van Orden chose to support tax breaks for billionaires and large corporations instead of protecting healthcare for the people they represent, us. Wisconsin families don't need more tax giveaways to the wealthy. They need affordable prescription drugs. They need affordable insurance premiums. They need access to doctors and hospitals, mental health services, and preventive care. We need elected officials who will work to make healthcare more affordable, not take it away. As physicians, our job is to help people stay healthy. We know that access to healthcare saves lives. When people have that coverage, they're more likely to get the care they need, and they're less likely to face financial ruin because of a medical emergency that could happen to any one of us. That's why we're here today. We are calling on Representatives Tom Tiffany and Derek Van Orden to stop prioritizing tax breaks for billionaires and start fighting for the health and well-being of Wisconsin families. The people of Wisconsin deserve leaders who will protect health care, strengthen Medicaid, and make care more affordable for everyone. Do your jobs. Thank you.